Will you teach me about endometriosis, its symptoms and treatments?
We know that living with endometriosis is extremely difficult. Endometriosis affects 1 in every 10 women in their reproductive years. It is considered one of the top 20 most painful disorders, is one of the leading causes of infertility, and currently has no known cure.
So endometriosis is when little fragments of the endometrium, which is normally the inner lining of the uterus, get misplaced and they're transplanted outside, usually inside the belly.
We don't know exactly how you get it. There are 2 main theories. One is that when you're a sperm and an egg and you turn into 1 billion cells and your eyes make it up here and your feet are down there, some of those cells might not make it back into your uterus and they get stuck along the way. The other theory is that you get retrograde menstruation, or when you're having a period, your uterus contracts and your cervix may close, and then your uterus squeezes and pushes blood out your tubes into your belly. And it may wash some of those endometrial cells out into your abdomen. They usually stick around your uterus and the pelvis, around your ovaries, sometimes on the bladder, but you can be on the bowel, other places as well.
Those little implants of endometrium can give you pain and severe cramps with your cycle because that blood has nowhere to go.
Endometriosis is a pretty common problem. It's a significant problem with pelvic pain for women. And it usually happens when people are younger, a lot of times late teens to early or late 20s. We see patients that have pelvic pain, pain with intercourse, painful periods. It gets worse usually over time. Can cause infertility and difficulty getting pregnant. Endometriosis is a little bit difficult to diagnose, but a lot of times it's pretty straightforward if you listen to a person's history and the problems that they're having. To definitively diagnose it, you have to have surgery to look inside and even take a biopsy. They actually look for endometrial glands, which are the glands inside the uterine lining that are on the outside in your body somewhere else.
There's definitely a lot of treatments for endometriosis. First line is usually oral contraceptives, as well as NSAIDs, your Motrins and Advils and medicines like that. Some patients need surgery to help clean things out and help them feel better.
You can have recurrence of endometriosis if you go in and burn or cut it out for treatment. A lot of times that will significantly help your pain and may help people with fertility, but sometimes it can recur. I know that people a lot of times will have multiple surgeries before their reproductive time is over. It's definitely a problem. Hysterectomy has been thought of as a cure for endometriosis, but I always tell patients it's a myth. If you have endometriosis and you take your uterus out and you didn't get out your endometriosis, you still have endometriosis. And so sometimes we have to treat it even after hysterectomy.
So if you're interested in further kind of workup for endometriosis, feel free to make an appointment. We can chat with you about options, including surgery if needed.